Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and doing well for your upcoming nursing exams. Okay, so we are posting a very important topics as well as important MCQs for your reference. So kindly subscribe our channel and follow our channel so that you will get more updates regarding the nursing competitive exams as well as some important topics also. Okay, we'll start the today's session with a small quote. Even if God has given up, perseverance will pay the wages for one's efforts. In Tamil, it's a famous Tirukural, Devathal Agadhenino, Muyarchidan, Meivartha Kulidhanam. Even God is given upon you, but your hard works will never fail. Definitely, it will pay you. Okay? Okay, we'll start today's session with a cranial nerves. Already we have seen the cranial nerves in the previous class. So today also cranial nerve related MCQs we are going to see it today. Okay. So the first question, Sally states she hasn't been eating very well. In your assessment, Sally states that she normally has a healthy appetite. Sally states that she is not enjoying her favorite foods like she used to. Which nerve could be causing Sally's problem? So in the assessment, you can see that Sally have the healthy appetite. She willing to eat a favorite food, but not nowadays. Why? So which nerve has been damaged here? So the answers they have given, option A 1, option B 5, option C 8, option D 4. So which nerve? So the right answer is option A number 1. So what is the number 1 cranial nerve? It is an, yes, olfactory nerve. So when there is an olfactory nerve is damaged, you will not get a smell of the food. So usually our appetite, when it will start, if you smell the food, right? So what has happened to Sally? Because of the cranial nerve, olfactory one nerve is damaged. She couldn't feel the smell, so that her appetite is not good. She's not like to eat the food. The sense of smell, the main thing for our mood to create to eat. Okay, you understood? Yes. So the nerve 1, that is olfactory nerve, is damaged here. That is why Sally's sense of smell is damaged. She may not feel like eating and may make her favorite foods not have as much as flavor or taste. Clear? Yes. So remaining, if you want to answer this question, you should know all the cranial nerves, the numbers and the names and their functions. So that is why we have taken the cranial nerve class previously, right? If you are new to this class, please go to the previous video. So regarding the cranial nerve, so you will get a basic knowledge about it. Okay. So yes. Next question. Kevin has been brought into the emergency room for a motor vehicle accident. Okay. Any accident. Okay. Kevin complains that he cannot see very well out of both eyes. His right arm is bleeding and he has a bump on the right side of his head. Which nerve could be damaged? Options. Option A, so 3, cranial nerve 3. Option B, cranial nerve 2. Option C, cranial nerve 4. Option D, 10th cranial nerve. The correct answer is option B. What is that? Optic nerve. Injury to the optic tract on one side results in partial blindness in the both eyes. Okay. So in the most of the motor vehicle accidents, the patient will come with a head injury, right? So when there is some damage to the optic tract in the occiput region, when damage to the optic nerve, definitely there is a partial blindness in the both eyes because the optic nerve is involved in the your vision, right? Yes. Next question. The nurse finds that Mary has diabetes in her assessment and interview. Mary complains that her head hurts constantly and his left eye hurts a lot. Which nerve would the nurse be concerned with? Options: cranial nerve 2, cranial nerve 3, cranial nerve 4, cranial nerve 5. So the correct option is option B, cranial nerve 3. So what is the cranial nerve 3? Yes, oculomotor, right? So movements of the eyeball. The patient will usually present with a sudden onset of unilateral ptosis. Okay. Maybe very rare case, bilaterally also it can happen. But most of the cases, unilateral ptosis will be there, which is frequently accompanied by significant eye or head pain. So the one thing we have to remember here, when the patient is having the prolonged diabetes or hypertension, in the both the conditions, commonly the cranial nerve is getting involved is, it is oculomotor, that is cranial nerve 3. Okay, please remember that. Next question. This is the largest nerve that has both motor and sensory implications. So we have already seen the type of cranial nerves, and motor and sensory also I have thought to remember the clock, right? Okay, tell me now, what is the largest nerve here, which have both the motor and sensory implications? 4, 5, 7, and 8. Which one? Yes, right answer is 5. The trigeminal nerve is the largest of all the cranial nerve. It has both the motor and sensory components, otherwise called mixed. Okay. The sensory fibers are generally somatic afferent and the motor fibers are special visceral afferent. You can see it is in the image. We have 3 branches in the trigeminal. The name itself, we can see tri. Tri means 3, right? 3 branches are there. Ophthalmic nerve branch, maxillary nerve, and a mandibular nerve. So it's supplying all over the faces, right? Yes, it's the largest cranial nerve. Clear? Yes. Next question. Claire presents with a Claire presents with a left drooping eye and a left drooping mouth. Which nerve could be causing the problem? So easily you can answer. So drooping of one side of the face, which is related to the facial nerve, which is 7th nerve, right? Yes. So damage to the cranial nerve 7. Okay, Bell's palsy. If you see the Bell's palsy patient or a facial, sorry, not Bell, facial palsy patient, they are one side of the face getting drooping. Okay, they're unable to close the eye completely or open the eye completely. Okay, and a frown-like smile will be there because of the one side of the drooping, right? Yes. Okay, that's all about today's class. Thank you so much. I hope you understand the class. If you have any doubts, you can type it in the comment box. So we will answer to you. Okay. We'll meet you in the next class. Thank you so much. All the best.